This is the 23rd week that we've been doing. It's the 23rd consecutive show. And it all started because of COVID. Everything is COVID. Everything is somehow related. But I really want to thank so many people for attending these shows. Some of you have attended all 23. I want to thank all the panelists, our regular panelists, Dr. Aline Kamakian, Dr. Kim Hakimian, Dr. Vikan Sepelian, and Dr. Shant Demirdjian, who've been very loyal and have participated in so many ways, as well as Greg Borazin from the Armenian Fund. And I also want to thank all of our speakers, some of whom are on the phone today, and who've done a wonderful job raising our awareness of the impact of coronavirus, whether it be in education, on research, telehealth, supply chain management, just a host of different issues. COVID has really changed many of the ways in which we do things. This week was a tragic week, not only on the COVID front, but also on the Lebanese front. We had a town hall regarding the various issues facing our brethren in Beirut back on June 11th. And back on June 11th, we were told by many of the nonprofit leaders who were on the phone that Beirut had a lot of challenges. It had socioeconomic challenges that were really shrinking that middle class and throwing them into poverty, straining our nonprofits that are performing extremely valued services there. So we had that. We have COVID straining the medical system, and COVID was on the rise. And in a few moments, we're going to hear Dr. Aline Kamakian focus on the COVID pandemic in Beirut and in Lebanon. By the way, she's also going to give our closing comments. But unfortunately, on August 4th, around 6 p.m., there was a tremendous explosion, just huge, devastating areas up to 12 kilometers away. Not only the actual explosion, but the shock wave shattering windows. At least 4 to 5 Armenians were killed, at least 100 Armenians were wounded. And I know some of you on the phone have employees in Lebanon who were affected, injured, and had surgeries. And again, prayers are for them. So this was a devastating explosion. And unfortunately, the Armenian area was about 3 kilometers away from ground zero. So we were very severely impacted by this. Hence tonight's meeting to help elucidate all of the different things that we can do to help our brethren there now and into the future. So I want to again thank you all for joining. I'm going to be introducing Dr. Aline Kamakian, board-certified pediatric infectious disease specialist at Maimonides Hospital. She has published in major scientific journals on COVID, gives lectures to professionals, as well as been tireless in her efforts of educating the various communities, both in public meetings and seminars and private conversations. It's really with great pleasure I introduce Dr. Aline Kamakian. Thank you so much for joining us tonight.
Thank you, Larry. Thank you everyone for joining us. And for those of you who don't know, I was born and raised and spent half of my life in Beirut. My sister and her children barely survived the calamity, catastrophe, disaster, preventable, man-made explosion that we are here for today. So we are grateful and blessed that physically we are okay. But as all of you know, such a thing will create a tremendous, both short-term and long-term mental trauma, financial trauma, and psychological trauma, in addition to all the other crises that were already ongoing in the country before the explosion and the pandemic, which is affecting us worldwide. So obviously I'm not on the ground in Lebanon, so the few slides I want to present about COVID-19 before we hear from our various NGOs is from speaking with some of my colleagues who are in Beirut and from the data that is available. COVID-19 is one of Lebanon's crises. I was very happy actually before the explosion to see that in a major journal like the JAMA, for those of you who are familiar with the journals, this is a top 3 medical journal on July 23. The medical school that I attended, the American University of Beirut, published their experience of COVID-19 response in Lebanon. And as the title tells you, it is a very low resource setting because of all the problems that the country was facing at the time of the pandemic. However, I must say, and I was very proud and pleased that in the beginning of the pandemic, from end of February until July, careful planning in the hands of very expert, many American board certified specialists, and good strategy, was fair containment of the virus early on. So they closed early schools and everything else way before we closed, for example, in New York. In the beginning, they focused on one hospital where the testing and taking care of patients was happening there while they prepared other hospitals in the country. They procured PPE and ventilators in that preparation. And again, there is no production in Lebanon, so everything had to be brought in from outside, partly from WHO and other aids, and partly it had to be purchased. On April 27, they decided to do phased reopening. First, they opened low transmission rate, high economic impact businesses, followed by low economic impact, high transmission rate businesses, to the point that on July 1st, they actually also opened pretty much everything, unfortunately, including airport, borders, and all restaurants and all businesses. And that's where, as you can see here, as of July 1st, the number of cases, unfortunately, have been steadily increasing. So that big blip that you see where it says August 4, obviously that day probably nobody in Beirut got tested, and the majority of people do live in Beirut. The majority of the hospitals are in Beirut, so we don't have data, unfortunately, from August 5 and August 4. But since then, in the past week, the numbers continue to increase. And therefore, because of that increase in July, even before the explosion on July 28, because of the growing number of cases, the Lebanese government had announced new measures in order to curtail or control the virus again. So they had recommended 2 weeks of increased restrictions. So many businesses closed again, bars, parks, beaches, markets, religious services, public events, and gatherings. And the date was supposed to be until August 10. Essential businesses were to remain open, and restaurants and cafes were allowed to operate with 50% capacity. And then they had announced a full lockdown in force from July 30 to August 3. So this would be Thursday through Monday. Remember, the explosion happened August 4. And there was supposed to be a subsequent lockdown, full lockdown from August 6 to August 10. So August 3, everybody was at home. August 4, what saved the life of my family is because they were out, because they were allowed to be out for a couple of days before they locked back down on August 6. So many people were saved that way, but many people also died in their own homes. And then because of the explosion, there is no new announcement except for the fact that there is general mobilization until August 30. There is no current curfew in effect. And as you can imagine, there is strangers helping strangers, as you have seen on the news and in some photos. Therefore, there is really no social distancing at this point. Everybody's trying to help each other, half the time wearing masks and half the time you can't because there's so much dust and glass you are cleaning. It's very hot there. And of course, there have been major protests because of anger and rage of the public against their government. And therefore, again, even though those protests were outdoors, but they included a lot of people in close contact with each other. So it is very, it obviously makes already a complicated situation worse. And I hope that people remind themselves that the pandemic is not gone. But as I said, the despair, the rage is probably taking over being cautious about COVID-19.
We are really very honored tonight to have so many people with us. But it's really with great pleasure that I introduce the Near East Foundation, who have been very gracious. That the Near East Foundation helped save 1 million Armenian lives during the genocide. And the irony is, some of those people were settled in Syria and in Lebanon. The reason why we originally thought of the Near East Foundation is also they're part of the solution. there, and I'll let Dr. Benjamin actually speak to it in more detail, but what they're really expert at is working in that transition, that gray zone, where you already have had some events take place. Now you're trying to get the communities up and running. You're trying to get businesses up and running. You're trying to make people self-sustaining and really feel good about themselves. And that's where they thrive. So again, Dr. Benjamin, I want to thank you for joining. I also want to thank your team, Kelly and Christy, who have been really just totally awesome to make this a very smooth evening.
Hi, everybody. So first of all, let me say we're really honored to be able to join you tonight. Thank you for the invitation. Really looking forward to hearing from the speakers and panelists and the questions. So as Larry said, my name is Charlie Benjamin. I have the really great fortune of being the current president and CEO of the Near East Foundation, which is an international development organization now more than 100 years old. We were known originally as Near East Relief, which I think a number of people probably know. So, but what I'd like to do is really, I just want to say a couple of words of introduction about the Near East Foundation, and then hand the floor over to my colleague Ziad, who can give a real picture of what's going on in Lebanon. So as many of you may know, the Near East Foundation, then known as Near East Relief, has its roots in responding to the Armenian genocide. During a historic relief effort, NEF helped save the lives of more than 1 million refugees, as Larry said, and cared for 140,000 orphans to the age of majority in more than 200 facilities across the Near East. In the process, we helped launch this spirit of what we call citizen philanthropy, which is everyday people engaging in philanthropy, helping people overseas. Since that time, we have supported long-term economic recovery and economic development in more than 50 countries, with a primary focus on the Middle East, North Africa, and the Caucasus, including a continued presence in Armenia. And as Larry said, we were prepared to say a little bit about our work in Armenia, how we're navigating through the COVID-19 situation, and maybe there'll be another time to talk about that. And maybe I'd be happy also to answer any questions that you have about what we're doing there now. Yes, can you see the whole screen, or I really don't know what I'm sharing here. Can you see the blue panel across the top of the slide?
Yes,
okay.
We can see it. Okay,
super. So I'm not going to try to summarize 100 years of our history right now. I will suffice it to say that through this experience, shifting from relief and caring for refugees and orphans to an economic development organization, the work that we did served as a model for the Marshall Plan, for the U.S. Agency for International Development, and for the Peace Corps. It was really a pioneering organization, and one that has just such a rich legacy. And you know, we like to point out that this really started as a bond between the American people and the Armenian people. And it gave birth to so many really important parts of our history as two peoples that not enough people know about. And as Larry said, Shant has done a great job in being an ambassador for this whole dynamic. We currently work in 9 countries, in some of the toughest operating environments in the world, including Syria right now, Iraq, northern Mali, and Darfur in Sudan. Our focus has long been and continues to be development, long-term development, even in the crisis. So as Larry pointed out, we work in very many turbulent areas. I think that's what happens over the long term. We focus on communities. Communities go through crises, and we want to be there standing next to them. We are not a relief organization, and I think that that's important to point out in terms of our role in Lebanon and our current work there. we focus on long-term recovery, development, and where we do work in crisis context, we focus on that transition from relief, the immediate needs of people, to their recovery and eventual return to, to the full vibrancy of their lives and livelihoods. We do prioritize what we call the most vulnerable in the communities where we work: women, youth, refugees, rural farmers, and we deliver programs that improve economic stability, resilience, food security, with the idea of having a multi-generational impact. In 2019, this is a few images from our work, only one of which is in Lebanon. We directly impacted the lives of more than 1.5 million people. Our work is organized into 3 broad program areas: inclusive economic development, stabilization and peace building, and climate resilient development. For each of the programs, we use rigorous metrics and indicators to evaluate impact. And this really, what this allows us to do is not only to understand the depth of impact of the work, but also to provide insight into what's working and what's not working, so that we can correct course where necessary. Okay, so one of the things that we'd like to talk about tonight, I guess the focus of our discussion of our work, is the current crisis in Lebanon. The Near East Foundation has been present in Lebanon since 1918, a long time. We had a continuous presence until 1983, when we left. We closed our office because of the Civil War, and worked primarily through local organizations, and importantly, the American University of Beirut, which we have a relationship even now. We reestablished our office in Lebanon in 2015, and our primary focus at the time was in Burj Hammoud. We saw this is our centennial. It kind of came full circle. Tragically, as Larry mentioned, a number of the refugee families that we worked with, and we worked with refugees and vulnerable members of their host communities to help them start businesses, achieve self-sufficiency, and reintegrate, economic self-sufficiency, and reintegrate into their new communities. So I think one of the real tragic ironies of this is that many of the displaced people from Syria who we worked with in Burj Hammoud were in fact people whose grandparents we had helped resettle in Syria at the time.
I now want to go to the second of 3 really heroic individuals who are our eyes and ears on the ground. And I want to emphasize that these are trained eyes and trained ears who do needs assessment for these 3 organizations. And many of the other organizations have similar people. There's just not enough time to have everybody come on. But I want to introduce Mr. Mike Garitlian, who really was so excited at the opportunity to meet everybody and tell you about the efforts on the ground that are ongoing by the Armenian General Benevolent Union, the AGBU. Thank you so much for joining us, and I hopefully hear your voice, but you look great.
Thank you, Larry. Good evening to everyone, and good morning to my friends in Lebanon. Before I share my screen, I'd just like to put things into perspective. Before the explosion, the disaster, we had major issues, as you know. We had COVID-19 like everyone else in the world. So we were, quote unquote, happy that that's something common to all the world. But we have and still have a major political crisis, as well as a major economic crisis. To put things into perspective, because you have to know that the consequences of the explosion are not only related to the explosion itself, but rather to what came before it. Any person who received a salary of about $1,000, let's say 10 months ago, now is receiving $200, the equivalent of $200. That is, if he is or she is receiving any salary, because we have a lot of businesses which have closed down due to COVID, due to the economic conditions, and due to the political conditions. In addition, so we have hyperinflation, we have a political crisis, and we have a meltdown of the banking system. Even if people have money in the banks, money which they need for their survival, as well as for handling the consequences of this explosion, they can only take small amounts of money from the bank one at a time. So basically, we are in a really difficult situation. What I'm going to talk about is simply what the AGBU is trying to do, and it has been actually trying to do not only now, but for several months now, to handle the economic and the political crisis. So basically, as my colleague Ziad said, on August the 14th, we had the disaster, and he elaborated on the effects. What I need to specify and what I need to stress is that we have, according to World Bank estimates, about 50,000 homes which are partially or completely damaged, and we have about 300,000 people who are homeless. And out of the 55 healthcare centers, when I say healthcare centers, I mean hospitals, clinics, only half are functioning. And as a member of the AGBU Lebanon Education Committee, what pains me is that we've got dozens of damaged schools. What did the AGBU do? Before we start talking about what the AGBU, we have to realize that AGBU, like all other Armenian establishments, like all other Armenians, in fact, like all other Lebanese, was deeply affected by the disaster. We had all our centers, our school, our dispensaries damaged. Luckily, major damage happened only in a couple of places, which are the AGBU Demirdjian Center and the AGBU school in Baye. In the AGBU Demirdjian Center, we actually had 3 of our members and 3 of our people who were injured, and they were taken to hospital, but they are now okay. Both our clinics in the Khail Badawi region and the Armenian Center were damaged. Some medical equipment there was damaged as well, but we're still serving people. We're trying to help people as much as we can. And we had the least damage in our Nazarian Zabel Mofsessian complex, where we established the disaster relief unit. So what happened is basically after the explosion, like everybody else, our young people, our scouts, immediately partnered with some NGOs on the ground, because the first concern was that people needed to clean the debris and the glass from their homes, from their shops, from their streets. And unfortunately, due to the economic condition and due to the political condition in Lebanon, the government, as usual, was very slow to respond. So we had NGOs, including our young scouts, working on the ground, helping people, started on the grassroots level, started with people we know, their neighbors, neighbors, and they're working constantly, day by day, to help people as much as they can. 2 days after the explosion, and what happened is that the AGBU leadership in Lebanon immediately formed a task force composed of all the AGBU and AYA local committees, as well as our school teachers, scouts, and everyone else who is actually involved or is related to AGBU. And this committee includes a civil engineer, obviously for the reconstruction purposes, as well as a physician for helping in as far as medical needs are concerned. And from day one, what was stressed is that this is going to be an ongoing effort, and everybody is going to pitch in as much as we can, financially, as well as through volunteer work. Our effort was actually 3-pronged. We started with, we didn't start actually, we continued what we had started earlier in January 2020. As I stressed, this is not the first crisis that we've been facing. We've been facing an economic meltdown. So ever since January 2020, AGBU had started delivering food parcels to about 100 families. These food parcels are designed in a way to cover the basic food necessities, including powdered milk, as well as cooking oil and some other necessities for a family of 4 people for 1 month. The number increased, and when the number increased, this means that the situation became more grave, to about 750 people, 750 families rather, in July. And this week, we delivered about 1,000 food parcels, 8 parcels to Armenian families in Beirut. And of course, unfortunately, we think that the number of people who will need immediate assistance in terms of food parcels will increase. What happened as well is that we tried as much as possible, although our clinics were damaged, we tried to provide basic medical assistance to people, especially in the affected areas in Khel Badawi and in Bush Hamoud. Now, what happens also is that starting Sunday, that's 5 days after the explosion, our emergency response teams, which are composed of teachers as well as volunteers, started going rounds to the homes of Armenians who were affected, to the homes which were partially or completely damaged, and started filling in the questionnaires. And one of the first questions we asked was whether they were contacted by other organizations. The purpose being is, of course, to avoid, as Mr. Ziad, my colleague, said, duplication. We don't want to duplicate. We don't want to help if somebody else is already helping or if they're helping in that particular area. So basically, the people that we're sending, the volunteers, are going to the houses. They're asking and they're filling in the questionnaires, asking whether they need food, medicine, whether they have a problem with some kitchen appliances. They're assessing the damage to the glass because, you know, many of the houses are not actually completely damaged, but for them to be livable, we need to fix doors, we need to fix the windows. So there's a lot of work that has to be done with glass and aluminum. And unfortunately, some of the homes are completely damaged, which means that we have to look for solutions for temporary housing. And AGBU Lebanon is actually trying to find accommodation with some hotels. And actually, I have to say that some hotels are providing free accommodation to people who have lost their homes completely. So you see some of the pictures, the volunteers are going through the homes, and all these pictures are credits of the AGBU Lebanon Facebook. They're going to homes, filling in the questionnaires, and immediately providing, if there's any need for immediate assistance as far as medication is concerned, as far as food is concerned, they are immediately being provided with that. To give you an idea of what happened, this is the damage done to some of the AGBU facilities. This is the damage done to the AGBU clinic in the Demirdjian Center. You see that some of the medical equipment might have been damaged. We're trying to assess, but as I said, work is going on and we're trying. This is the damage that was done to the AGBU Demirdjian Center. You see the basketball court, and there were actually people playing a game there. So what happened is that the falling shattered glass actually injured some people. And for those of you who know Mr. Cherchan, he is the chairman of the local AGBU AYA Central Committee. He was actually gravely injured, but he's now doing well. In addition to the effort that's being done by our volunteers, which is going out and helping people directly through cleanups, through food, medication, as well as preparing an assessment for repairs needed in the homes, there are a lot of efforts being done by people who are actually related or affiliated to the AGBU. I especially note the efforts of Miss Aline Kamakian, whom you may know. She is the owner of Mayrig and Batchig restaurants, as well as the owner of famous Mayrig restaurant in Armenia. She is actually working with international NGOs to provide 500 hot meals to those who are in need, and our volunteers are helping with her efforts. But before I go to the final words that I have to say, as someone who is involved in the education field, I'm a member of the AGBU Lebanon Education Committee. In addition to all the damage and all the problems that we are facing, and of course, all the good work that's being done, not only by AGBU, but all other NGOs, all the other good people, including the Near East Foundation, and I'm sure all other people. I have to tell you a few things. First of all, we have schools coming in a few weeks. We need to have our children go to school. Unfortunately, due to the COVID-19 situation, I know that we will start online. My main concern as someone who has children and as someone who is involved in the field of education, we have major problems. First thing is that we have to put roofs over some children. Second, we need to make sure that these children will have electricity in their homes. Third, we need to know that they have reliable internet to access their online lessons. And fourth, we need to know that their parents will be able to work, to find employment, because unfortunately, from our experience from last year, we didn't have this explosion, but the situation was so bad. And I know that many of the other NGOs can tell you that people were not able to afford paying their tuitions. So we have, in addition to all the humanitarian problems that I talked about and all the issues that we talked about, reconstruction and medical issues and health problems and COVID-19, we have a major issue waiting for us a few weeks from now. But I think that AGBU and all other NGOs are trying and doing our best, but we definitely need support. And all of this would not be possible without actually our volunteers in the AGBU disaster unit and all our friends who are supporting. And of course, without our donors who have already donated to the AGBU Humanitarian Fund for the relief of Lebanon about $2 million, $1 million donated by a group of donors matched by the generous donation by Mr. And Mrs. Bache Manugian. So definitely every type of support, whether it is an in-person support, whether it is people who are volunteering, whether it's people who are donating to NGOs, every bit will help to make the lives of our people here in Lebanon, whether Armenians or non-Armenians, much easier. Okay, thank you for listening. And if you have any questions, I'm ready.
Thank you again for joining us. Really helps elucidate on a very personal level what's happening in Beirut, and really helps us formulate our response. We are also honored today to have Reverend Nishan Bakalian with us. He is doing outstanding work with the Armenian Missionary Association of America, led by Mr. Zavan Kanjan, who was on the phone with us as well as several of their board members. Reverend Nishan, thank you so much again for waking up at this ungodly hour and sharing your experiences with us.
Thank you very much for the opportunity. As probably the tail end of these speakers, I probably have less to say because so much has already been said and shared by what all of these organizations are doing. And I'm really grateful that we're not alone in any of this. I'm a pastor in the Armenian Evangelical Church, which is one of the 3 Armenian denominations, and I'm also related to the Armenian Missionary Association. So I have a couple of different things that I'm involved in, but I'll try to give you at least some perspective as to what the Armenian Evangelical Church, and especially through the empowerment by organizations such as the Armenian Missionary Association, is doing here. I want to point out the Armenian Missionary Association was created in 1918 in the midst of the genocide, and has been a very has had a very great impact in the rebuilding of the Armenian people in the wake of the genocide, especially in the Middle East. And since the earthquake and the immediate post-earthquake period, very significant input in not just relief, but also development in Armenia. So to talk about what my perspective is here as somebody who, like my colleagues here in Lebanon, went through in the past 9 days, it's been a very trying time because because of all the pre-existing situations here. And it's very difficult to think about disaster relief when so much was already needed prior to the disaster. As was mentioned, since last October, but not since last October, things erupted here. But the difficulties, the struggles have been in years, the years leading up to it. I mean, we talked about economic issues, social issues, reduction of income, increased food insecurity, political struggles, adding on to this COVID-19 and the efforts to contain it. But underlying all of this is a dearth of public services. For example, the entire month of July and into August, we were living with 2 to 4 hours of electricity per day. And you can imagine how your lives would be impacted if that's all the electricity you had in 24 hours. Of course, so many places have generators or supplementary electrical subscriptions. Well, those generators were operating for a large portion of each day, which means that the respiratory issues are going to be increasing, are increasing and are going to be increasing. The air quality is very bad here. And in many cases, those generators shut down for overnight. And so we spent a month before the explosion not sleeping through the nights. So hot and humid and no electricity from midnight until 6 a.m. when generators started up again. You know, this is the context in which this disaster happened. So to get back to what organizations such as the AMAA, I'll use the abbreviation, it's a lot easier. What the AMAA is doing is, again, just one portion of the mosaic of what Armenian organizations especially, not exclusively, but especially have been doing. And the work, the impact of the AMAA is not so much in disaster relief because it's a pre-existing organization which already is supporting so much of what's going on in the Armenian community and enabling it to do its work. My familiarity is most with those Armenian evangelical organizations or related organizations that we're working with. We have a Christian Social Service Center in the Burj Hamid area called Tarad. It's a very impoverished, mixed neighborhood, Armenians and Muslims and other Arabs. We also have a joint ministry with for the old age home with the Armenian Apostolic Church and with the Armenian Catholic Church for the Armenian Sanatorium, which is another type of old age home way outside Beirut in Azuniye. We also, this is one of the forgotten, let's say, organizations called Ehlan, which is the area of Armenian homes, which doesn't have any particular supporting organization, but really belongs to the entire Armenian community. In these areas, and I've spoken with directors in these efforts, the most significant need right now is building material. More than anything else, it's building material. And that's something that we are not equipped to do. We have to work with other organizations and try our best to help people to stay in their homes. I would say these are probably as significant as health or medical concerns. So what we pay attention to are more the ongoing issues that people are facing. Lack of employment, lack of nutrition, lack of medications or the ability to buy medications for chronic issues. People have stopped taking their regular meds for hypertension or for diabetes or for heart conditions or for breathing conditions. And I don't know quite how to put this, but they couldn't afford their medicines before this explosion happened. And so they would come to our centers and ask for assistance. How do you describe the change from not being able to afford medications to, I don't know, negatively not being able to afford medications? That it's really gone into a deep pit. And this also includes parents who need to buy baby formula for their children and are unable to, and are resorting to measures, and this is something we know firsthand, resorting to measures like feeding the infants sugar water instead of baby formula. And so we're looking at, in the future, long-term consequences for all of these issues in Lebanon, and because the Armenian community is part and parcel of Lebanon, in the our entire situation here. It was mentioned that COVID-19 precautions are somewhat being abandoned because of the urgency of the situation. I try to tell people whenever I have the opportunity that when they say, forget about COVID or forget about coronavirus, I say, but coronavirus has not forgotten about you. We have a specific concern for children and youth. This has always been a central part of the outreach of the Armenian Missionary Association, which is why, in particular, the educational efforts, schools and Haygazin University here in Lebanon, in Beirut, has been a particular target for what we do in our particular circumstance in our church and church outreach. The Armenian community in Lebanon has to be mentioned that they have a very close connection to their churches and organizations and the structures, the Armenian structures, the existing structures. So these, of course, are the most important channels through which assistance can be given. So each one of these structures is doing its utmost to keep that focus on the children and youth. We are seeing, especially in our work in the impoverished areas where there are many poor Armenians, we are trying our best to keep these children and youth to continue their education, to not be a lost generation. And this losing of this generation is something that's been going on for decades. And so these efforts in development, in education, are crucial, especially with an ever-shrinking middle class in Lebanon. So I also want to underline the urgency of mental health care in all of this. Bleeding wounds and broken bones are one thing. They're healed, they're set, they're taken care of. Homes are reconstructed, walls that have fallen down are put back up. But the emotional and psychological well-being of the people is something that is, it's being worn down. It was already worn down to almost nothing, and this has worn it down even further to the bare bone. So whatever we do, whether in religious organizations or social services, there's always that component of emotional care and psychological care, right alongside medical concerns.
Dr. Zadin, would you have any comments you would like to add to Reverend Nishan?
Yes, thank you, Nishan, for that description, sad but reality description, and thank you everyone who's on the screen, and especially those who have woke up very early in Beirut and participated in this forum. Scripture says if one part suffers, every part suffers with it. And that's what we're seeing here. That's what we're seeing in this forum. That's what we're seeing on the ground in Lebanon. Everybody is trying to do their best to alleviate the pain and suffering that we see in Lebanon. You see, most of the world woke up on the sound of the explosion to find out what's going on in Lebanon. But you and we know that Lebanon has been suffering at least, without going back into the decades, at least since October, where it was political, economic, financial, COVID-19. And finally, we experienced this explosion and the aftermath of the explosion. What I'd like to say is that I see two phases of reaction on our part. Number one is immediate, and we've heard about that. It's wonderful to see this. I think this crisis is going to continue for a long time. You see, the AMA is intertwined with organic life in Lebanon. It's not that we are now reacting to a crisis. We've always been supporting and sustaining education, youth services, social services, spiritual services, all that over the years. And the AMA has continued funding and appropriating millions of dollars annually for all the needs of our people in the Near East. So we will reach out, we will cast out fear, we'll inject hope and resuscitate our people, repair the damage, sustain health, education, and mere life. Many examples were given. People do not have their immediate needs of the day. So we're all doing that, and we'll continue doing that for some time, hopefully sustaining the people. But I'd like to inject something else here for your information and actually for your ears, because we don't have to spend much time on it here. We will not, but it is absolutely and absolutely important. We need to develop a strategic plan in a partnership of the homeland and the diaspora for the future of our communities in the Middle East. We can be optimistic about the future of Lebanon as we might have been optimistic about the future of Syria and Iraq and Egypt and Iran and. But we have to be realistic. We have to be realistic of what's going on there, and we have to most in history we have almost always reacted to events and reacted to calamities. It is time that we get together and we learn to be proactive. We have a large community in the Near East. Still, we have a large community in the Near East, and they need all our brains, their brains, everything to put together as diaspora and Armenia and work on some kind of a future plan for the communities in Lebanon, especially in Lebanon and the rest of the countries. We will continue on our support. We've been raising funds. Yes, we too feel and the impact on non-Armenians in this community. We saw that during the earthquake, we all remember. And we're seeing now this time as well how people react, because the explosion brought things up to the surface and everybody saw what has been going on there for so many years. We will continue on our fundraising, and we will sustain this cooperative effort to help our kin in Lebanon.
You're fervently striving, and you spoke very eloquently of the desire to be proactive and to work cooperatively. And it's really awesome to hear that. And it's awesome to hear that spirit with Mike and Reverend and Ziad, of that collaborative spirit. We heard of systems being overwhelmed, and I would like to hear from the Armenian Youth Society and the Janitian Foundation a about the impact on your organizations, mindful of the fact that the people who are working for your organizations are simultaneously maybe displaced from their homes or have loved ones who are injured. What's that like on the volunteers, your employees, and how is it impacting on your programs? So Demirdjian, thank you so much for making a comment.
Thank you to AAHPO for inviting me today. It's my pleasure to make a comment about what the Armenian Relief Society is doing in Lebanon as well as other regions, because Lebanon is not our only crisis region today, as of today. So when the devastation of August 4th started, our first initial reaction was, how can we fundraise and how can we get money to Lebanon? Basically, I'm going to just give you the short end of it because everyone else mostly talked about everything they're doing, which is similar to what we were. We decided to automatically send $30,000 without even any reaction over to Lebanon, which we were able to pull out before the banks closed. And we have now sent near $100,000 in the past week and a half, because we actually sent our first initial transfer the day of the explosion before it happened. We have been able to pass out nearly 1,000 meals per day since the explosion, well, since Friday after cleaning up for 2 days. And we were able to cater to 240 of the most heavily wounded people in the Burj Al Mud region. Now, the most exciting news is that within a week, we were able to get together a shipment of medical supplies and necessities that is going to be airlifting with the help of Greg and Armenia Fund, as well as Code 3 Angels, who volunteered to get all of our equipment for us. It's going to be airlifting soon and will be arriving early next week in Lebanon, and I'm sure Greg will be talking about that as well. And the beauty of this is not only helping the Armenian community in Burj Al Mud and surrounding areas, but we are actually going to be partnering with a few Lebanese nonprofits from Los Angeles who have agreed to jointly help the Rafiq Hariri Hospital with essential supplies. Now, since a few of you spoke about COVID-19 and the concern is COVID-19, the ARS has taken the precautionary steps with COVID-19 in Lebanon in hopes that we were able to send enough Z-Packs as well as vitamin C, zinc, and so forth to our community to make sure that they have enough of it. We've also sending 50,000 masks on the flight so that people can have plenty of masks. We're sending 1,000 hand sanitizers as well as other essentials such as for the old age home, for example, like adult diapers and things that will not be available right away in Lebanon. Now, when I said crises, I want to switch over to Syria, like Mr. Khanjan did say. We found out recently that there's multiple deaths from COVID-19 in Syria, in the Armenian community, that had shown no cases since the start of COVID-19. And the unfortunate situation is that they don't have testing. There is no test kits available. There is a shortage of your daily vitamin supply in Syria. And we do have multiple hundreds of people who have no idea if they have the virus or they have virus-like symptoms. And so we immediately sent over money in the hopes that they can find the products. And if not, we're going to try and find a way into Syria, especially Aleppo and Damascus, where the outbreak is the greatest, and see if we can get them the medical supplies. Also, the Armenia Fund, ARS, Armenian Relief Society, as well as Code 3 Angels, are hoping that once we find out what type of lab equipment they use in Lebanon, we can get access to large quantities of COVID-19 testing. Actually, I'm working on it. Greg's probably going, Nairi, what did you do right now? And hopes that we can get another shipment out, especially with the COVID-19 materials that they will need, because there is going to be a shortage. And on the last note, the road to recovery in Lebanon is beyond just the physical damage. The PTSD and everything that is there we all need to work together so that we can rebuild that community completely. And it's not just the nonprofits and the NGOs. I agree with what Mr. Khanjan said. This is a global Armenian issue, and we need to get the government of Armenia, as well as the Armenian nation state, as I like to call it, involved to get the entire diaspora as one, and Armenia as involved with it to rebuild that community. Thank you.
Thank you, Nyreen. Thank you for that great work. We'd love to hear from the Janitian Foundation, whose executive director is with us, Eliza Manassian, about the relief efforts and what you're doing in Lebanon and Beirut. Thank you so much.
Thank you, Larry. I want to second Nairi in her concern regarding the Syria before I go to Lebanon, because I also get very seriously warning signs regarding COVID in Syria from our office and our beneficiaries. And I think that is another big emergency coming for us, and sooner we address it, the better. Our staff, their family members are suffering, having all the symptoms, and there is no testing and no sanitary means to keep up with all the requirements for safety. And the situation wasn't like that before. It deteriorated the last few weeks for some reason. Now, I mean, we know for what reason, but it was kind of stable, better before. Now regarding our work in Lebanon, in Burj-Chamut, our office and dispensary exists for 55 years, and providing health development programs, family and social support for seniors and families, community development and housing. We actually already sent an extra budget prior to the explosion to Lebanon related to the challenges they face with COVID and economic recession. So they do have now a budget to respond immediately to the current new needs. Office and dispensary windows and doors are fully damaged, and we do fast repair to be able to open as soon as possible and provide the needed services. Also, our office staff homes are damaged and need repair. Not talking about trauma, but everybody is ready to come to the office once it's cleaned and repaired and continue providing our services. It's needless to say, we are overwhelmed with the need all over. And by the time we are open in next week, I believe, we should be ready to provide support through meeting the medical needs, providing medicine for chronically ill, and through Janitian dispensary, which thanks God wasn't really damaged as much as the rest of the office. Participating in surgery bills as we did before, diagnostic treatments. We will increase social support to families for those who were injured by a devastating blast. Also, we, as the rest, receive donations for Lebanon, and we are directing them all right now to go toward housing repairs so families can safely return to their homes. That's shortly it.
This concludes our 23rd AAHPO Town Hall. And again, I want to thank each and every one of you and all of the NGOs for all of the great work. And we'll see you next week. You're all invited back. If you need anyone's contact information, please let me know. If you have any medical supplies that are needed, please email aapo.org.